please help spread the message of frequency-specific microcurrent by clicking on the like button. You can subscribe to us on YouTube or any podcast app. If you have any questions, please leave them in the comments. You can find the podcast transcription at frequencyspecific.com, as well as more information about frequency-specific microcurrent.
Hello, everybody. And there she is already, right on time. Welcome. I'm glad we finally got all the technology to work because Carol and Kevin are across the planet right now in Poland doing great things. And so I get to have a wonderful guest on because even though Carol says I should just talk to myself for an hour and answer questions and talk to everybody, I am much rather to be on the question asking side of things. So Thank you for taking time out of your extremely busy life to chat with us. And we have a rough list, but I'm sure we're going to meander a little bit because you talk so fast and with so much knowledge that there are so many people that wrote back on the podcast and on YouTube, like, your conversation went so fast. I'm like, well, just play it back multiple times or play it back in slow speed, because I don't know how it is with you, but I know when I get excited about something, so talking about coaching or talking about movement, I start like getting just super excited. I want to get all the stuff out. So my job today is going to slow us down. We have a common theme. We're going to talk about some autoimmune and autoimmune in general. And as I listened back to the last time that you were on, I'd like to make sure that we pay homage to the practitioners and to the patients that are listening. So one of the first things I'd like to talk about with autoimmune is if a patient suspects that they have an autoimmune, I find that some of our mainstream doctors are just really quick to either dismiss it or to say there's nothing you can do or it is what it is. And I would like for you to maybe talk about your approach or what patients can do to like advocate for themselves, what we can do holistically, what sort of tests they should be asking for. And I know that's a big umbrella because autoimmune is full of so many different subcategories of disease. Maybe you could talk about some of the more common ones that we see or hear of and what we can do if we get diagnosed with one.
Yeah, absolutely.
And that'll take a little bit of time.
Just a little bit. I also wanted to delve into a little bit on some sleep apnea. I always laugh at Carol. She was the one that kind of set me on that path way back when, saying, if you don't treat sleep apnea, or if you have sleep apnea, whether it's diagnosed or not, if you don't treat it, you will die because of it. Not with it, but it will be because of it. It's that important. That really hit home with me. And as I've paid attention in my day-to-day practice, most of my chronically ill patients have sleep apnea.
Wow.
Why the heck is that? We know Americans today, and I'll get into the autoimmune. I don't mean to totally distract from where you're going with it.
We'll get there.
It's been definitely something I'm looking at more and more, because if most of my chronically ill people have sleep apnea, yes, we know sleep apnea is way more common today, where it's an epigenetic phenomenon. We're not eating tough enough food. We're not eating chewy enough food. Our jaws aren't getting created as well. And because we're having baby food, we're supposed to be chewing on hard food from the very beginning. And instead we get baby food, which is absolutely the wrong possible thing for us. But over generations, our mandibles are getting less strong. We pull out our wisdom teeth, so everything falls back. And then you've got worse and worse sleep apnea over time. So it's actually epigenetic as well as just caused by our own diets along the way. And so we're seeing a lot more of it in general in the population. I don't know if anybody's actually done a good population sample to see what percentage of the population actually has it of a random sample, but I swear 80% of my chronically ill patients have some sleep apnea. So that's telling me there's something going on there. And I'm beginning to believe that having chronic sleep apnea, and most of my clients are not the morbidly obese type that get sleep apnea because they're too fat. Most of them just have too small of a mouth, too small of a throat in the back, and they're not breathing well. And that's something they've done since birth, because that's a birth thing. Yes, it'll get worse with age when the tissues all sag, then there's really less space in there. But if this is happening from birth, we've got an unwell brain and an unwell system from the very beginning. So is this what actually promotes the dysfunction that ends up being low energy? If you talk to Rob DiMartino, it does low energy. And is this what we're actually combating? is some chronic sleep apnea since childhood. I'm really beginning to think that this is way more of the real central underlying issue, because even CPAP machines or mouth guards, they don't seem to be doing the job the way they're supposed to. And so I've been looking into other stuff, like what else is out there, because our immune system is dependent on our brain function. If our brain's not working very well, there's our immune system not working very well to keep us feeling better in the long run either. There's got to be more out there. I'll go more of that direction in a bit.
No, that's a heck of an intro. And I don't want to oversimplify what you're saying, but sleep is everything. And whether you're talking about somebody who's chronically ill or I'm working with an Olympic athlete, the first three questions I'm going back to is whether it's an injury or a performance enhancement is, how well do you sleep at night? And I think we have to, so if we're going to go down on the practitioner side, what kind of questions are we asking about sleep, and what kind of tests are out there that we can guide people to getting a good idea what their quality of sleep is like?
Yeah, there's a couple of good things, and that's where I've been really searching for more, because we do home sleep studies all the time now. And we have a company that can do them within 2 weeks, which is awesome. And they can do it pretty much anywhere in the country, which is awesome. Most of the time, the local clinics are like 2 months from now, maybe you can get a home sleep study. They just don't have the equipment. They chose really poor equipment that doesn't get good results. You've also got to know your sleep data. You're looking at REM sleep, you're looking at deep sleep, and the home sleep data doesn't do really good on deep sleep. But when you have sleep apnea, you're breaking out of deep sleep or REM sleep, and you're never getting enough of it because you keep breaking out to wake yourself up in an apnea episode and then going back in. So it's a lot more fragmented. But on top of that, deep sleep really suffers. REM sleep is fairly well maintained, and REM sleep is supposed to be about 25% of your night. If you're not getting, that's a problem. REM is where you consolidate all your memories from the day. And deep sleep is where you detox the brain. And deep sleep should be about 20% of your night. So even with bad sleep apnea, REM is fairly decently maintained. Deep sleep sucks. People can be having 8% of their night deep sleep instead of 20% of their night. It's just horrendous. And so there's a huge, you can imagine, we know how important detox is just for the rest of us with this world we're going in. And then you put together a brain that can't even detox itself. You can imagine what the higher risk of dementia is. So I'm starting to think sleep apnea just on some basic questions. How are you sleeping? Do you fall asleep right away? Or are you awake for a long time? Both of those are a risk factor. If you fall asleep anywhere, anytime, that is sleep apnea. You should not be that tired. And if you're taking an hour or so to fall asleep on a regular basis, that's a problem too. Both of those are bad. Or if you're waking up 2 or 3 times a night, even if you can go back to sleep, that's a concern. So I'm asking some of the basics, and then how often are you not even going to bed early enough to get enough sleep, even if you could get enough sleep? Obviously, that's part of it too. But interesting, there's 2 ways that I've found to look at it on testing as well. You can look at the blood count, and that's the red blood cell count, hemoglobin, hematocrit. Most people with sleep, if you're at a high altitude, all bets are off, because everybody has a higher hemoglobin, hematocrit, red blood cell count at altitude because they're trying to grab more oxygen. But if your red blood cell count, hemoglobin, hematocrit is high, and you're like at Phoenix level, which is 2,000 feet, you shouldn't be having it. And so that's my first, oh my gosh, you've got sleep apnea. Unless they're obviously dehydrated at the same time, then that'll change things a little bit. But my first go-to of that is sleep apnea, because your brain is thinking that you're at altitude because you're not getting enough oxygen all night long. So it makes more red blood cells to give you more oxygen, but it's not a matter of altitude. It's a matter of you're not breathing well enough. And so it stays high. It's a good check and a balance. I also look at salivary hormone testing. So I'm testing cortisol levels. And I see this nice spike of cortisol first thing in the morning, and then it's like nothing the rest of the day. You just spent your whole wad of cortisol all night long, and you got nothing left for your daytime. That is not, hey, mildly dysfunctional adrenal function, which is what they tell you. This is stage 1. No, that would be really bad adrenal function because you spent it all night and you got nothing for daytime. Right. But it's a fairly classic look to it, that once you see it, you're like, oh, okay, now I get it.
Do you take into consideration, everybody seems to have either a watch that tracks their sleep or a ring that tracks their sleep. I like to compare both my devices at night to see, and it's amazing how accurate they both are. Now, I sleep incredibly well, thanks to you. I don't wake up crawling to the coffee pot anymore. I enjoy my cup of coffee, but I don't need my cup of coffee. Going back to some of your questions, how do you sleep well at night, right? That's really easy for us to be like, yeah, sure, because it's amazing how used to crappy sleep people get. So I've seen people survive off of 4 hours of sleep like it's nothing, and they won't even tell you, and they'll lie and say, oh yeah, I sleep fine. And it's 4 hours.
Right. And you do have to, and I would go with you on that one. You do have to ask more questions on that. How much coffee are you needing? Are you actually feeling rested when you roll out of bed in the morning? Or do you have a really low period in the day, energy wise? So I'm always asking about energy throughout the day. Is it waxing and waning? If it's terrible first thing in the morning and great at 10 o'clock at night, you got some issues going on. It may not necessarily be sleep apnea, but there's some issues going on in there. But hearing that, yeah, I feel great in the morning, or I'm exhausted in the morning, and then I have this big exhaustion again later in the day, you got to look at sleep apnea, because sleep apnea is probably the biggest adrenal stressor out there.
Again, I'm just going to go back and then we'll go forward. So when people get ready for bed, we had a great talk a couple years ago with Dr. Musnick, talked about sleep hygiene. And there are so many things that we can do to prepare for sleep, getting our house cool, getting our house dark. And I'm not trying to take away if you have sleep apnea, but there are things in conjunction with treating apnea that people need to get better at. When we were cave people, it's not like there was a switch and all of a sudden the sun went down and the moon popped up. But that's what happens in our world right now. We go from crazy bright light, screens, music to, oh, it's bedtime, shut it down. There's no wonder our brains don't know how to turn off. Right. And you said something really important too, is how long are you lying in bed waiting to fall asleep? The magic number used to be 4 minutes. We want to see people from the time that they commit to sleep to falling asleep being 4 to 8 minutes was typical. Anything longer than 8 minutes, you should get up, do something else, and then retry again. But people are in bed on their phones, watching movies, answering emails, and that's not healthy for our brains either. So
it's interesting. Actually, I've got an Oura ring, so I've been using an Oura ring for the last 3 years and love the data from it. It actually stopped me from drinking alcohol almost ever, because the first thing that happens when you have alcohol, even if you have it at 5 o'clock at night and you don't go to bed till 10, your deep sleep, your REM sleep goes to hell in a handbasket. And it's just like, no wonder why I feel like crap the next morning every time I've had something to drink. It's not necessarily the alcohol per se making me feel bad. It's the sleep that just didn't happen the way it was supposed to. So obviously that's something to ask. You're not going to have your athletes drinking a bunch of alcohol, hopefully, but that is also something to ask about. But the other thing that happens when you're on your phone right before bed is you lose deep, typically happens at the very beginning of the night. And you shut down deep sleep for about an hour after you've been watching a screen. And so you've lost your best hours of deep sleep, the stuff that you go into right after going to bed, and you don't get that back.
One of the other things that the rings can be very helpful with, talking about alcohol really quickly, is it helps me not to snack or eat late, because I notice if I'm eating very close to bedtime, then my temperature is high and I'm also not getting into the best sleep. We're not getting paid by Oura.
But it's amazing.
Yeah, it is. I absolutely love it. I recommend it to everybody, especially the perimenopausal group out there that are trying to figure out what the heck is going on. So we want to take care of our sleep. So the sleep is going to be the common theme of the day, I think, regardless of, like I said, autoimmune to athletes. We want to make sure that we're sleeping. Right. So now that we have the data, whether it's blood test, salivary hormone, we got our Oura ring, we have our Garmin, everybody is telling us we're sleeping like crap. What did we do?
One of the things, just to go back just a second before you get into what do we do, there's a company right now in California that I just got connected with a couple of months ago that actually, whether you've got an oral device, like a mandibular device, whether you've got a CPAP machine, they'll work with you for several months, sending you a home sleep study and then reviewing it with you every week to help you optimize your sleep function.
Wow.
So they said they work with people anywhere from 1 to 3 months on a weekly basis to help you get the optimum function. Are you on your back? Are you on your side? It'll give you all your basic data so that you can actually get the best possible options. Because we all know you give a CPAP to somebody, half of them don't even get any benefit out of it, or it makes them stay up even more because they're not comfortable with it. So having a company that does something like that is amazing.
Yes.
And it's something that you can put on a kid's finger, because normally they won't do home sleep studies on kids less than 18, which who the heck is going to sleep in a sleep lab at that age? If they're a teenager or younger, they're not going to sleep. So having a company that'll be willing to do that kind of stuff has been really helpful. And to see how similar it is to the Oura Ring, as I wear both of them at night, because of course they gave me a free month to, hey, go play with it before you're giving it to people. But I've sent 3 or 4 people to them within 2 weeks to just, hey, these are my disasters. I have no idea what to do with them to get them better along the way.
Really interesting.
Go.
No, I was going to say the whole sleep lab, I think even with adults, a lot of the data has shown that you're not getting the same sleep when you're sleeping in a lab than you are at home. So I wonder just how, if it's really crappy in the lab, I'm sure it's crappy at home too, but yeah.
And we know that there's a little wild animal in us still, where we're alert to our surroundings. And the first night in a new place, whether that's a hotel or a sleep lab, you don't sleep well, because you got half your brain going, oh my God, what's going to go on in this place? And so you literally don't sleep the way you're going to there. And it's not you, it's your brain being aware that, hey, this could be dangerous. It's a poor setup.
Right. Yes. So now that we have data to show that we have sleep apnea, or maybe not sleep apnea, but maybe an undisrupted sleep, what are some of the things that we can do? And I'll talk about the sleep hygiene part. But if you're going to address sleep apnea, and for the lay people that are listening, the patients that are listening, sleep apnea is just defined as lack of oxygen while you sleep. So it's the snorers, the gaspers for air that you would think is funny when your Uncle Fred fell asleep on the couch and then would literally snore himself awake. When I was pregnant, I snored. That was the only time in my life that I was a snorer. And I remember snoring myself awake in a yoga class, actually. But not all of us just get it 3 times in their life. A lot of us are struggling with it. And like you were saying, it's not the morbidly obese necessarily people that you're finding with sleep apnea. So you talked a little bit about our jaw and our jaw formation, the lack of muscle tone, perhaps, that's keeping our hard and soft palate in place while we sleep, or sleep appliances, I'm guessing, oral appliances that we can sleep with that put us into alignment, or that just, I imagine, thrust the jaw.
The most common ones are ones that kind of lock your lower jaw forward, because what happens if you have a small airway, particularly if you lie on your back, but the minute you lie on your back, that posterior jaw falls back a little bit, and then you shut off your airway, or almost completely shut off your airway. And sleep apnea isn't just not getting enough oxygen either. You also really interrupt your deep sleep, your REM sleep, because every time you do that, you're falling out of the sleep cycle that you're in and go to an awake state and then back to a deeper sleep state. You're in and out of cycles. You're not getting the full amount because you're in and out a lot of the way. And for some people, it's true apnea. So they're really dropping their oxygen. I've had people drop their oxygen to 68%. We're supposed to be 96 to 98% all day. I've had people come in with sats of 68% for 10% of their night. You're supposed to be on oxygen if your oxygen's less than 88%. And these people are dropping to 68. They're like half dead.
So I have a side story, and I'll be brief with it. My middle daughter had terrible chronic illness from around the age of 8 to 9 years old. She was little, I would say almost failure to thrive. We couldn't put weight on her. She always had sinus infections. She snored like crazy. We were living in Canada at the time, so it took 11 months to see a pediatric ENT, and that could be a whole other podcast right there. But by the time we went in, they sent her home with a pulse ox monitor and said, if her oxygen is below a certain amount, then we'll consider a tonsillectomy. She had what's called kissing tonsils. Her tonsils were so inflamed that they were touching, but because they weren't always infected, they didn't want to take them out. Fast forward a few months, we end up in California. We get into a pediatric ENT within weeks. He said he's never seen a child with such big adenoids and tonsils, and he really thought her failure to thrive and the reason why she was so sick is because she wasn't getting restorative sleep. An 8-year-old who's super skinny shouldn't be snoring so loud that the entire house wakes up. That's never okay. So the doctors that just placated and said, oh, it's fine, she's just a snorer. No, that was wrong. She got her tonsils and adenoids out, and within 6 months, she grew almost a foot, and she was gaining so much weight that her back hurt because it was just like a flower that was finally fertilized in a garden. Now she's taller than I am. She's never been sick, knock on wood. So the sleep apnea thing is really dear to my heart because you would never expect a skinny little 8-year-old to be suffering with this.
And your testimony to exactly that. And interestingly, I see a lot of sleep apnea in our autism kids.
Interesting.
A lot of sleep apnea. I'm like, man, like maybe these are some of the kids too that have had problems since birth. I had one kid that was getting MERT therapy with us, and he was high functioning autism, but just they were having all kinds of behavior problems. And I was like, finally, I was like, you know what? Because he was snoring. And I said, let's just do a sleep study. And this was before I had the home sleep study option. So she had to do one. His oxygen was going down to 72 at night. There's the problem. But he didn't have big tonsils. And so try putting a kid on CPAP. That ain't happening either at this point. But I think for a lot of people, particularly kids that have problems, because I remember when I was a fresh out of school resident, in my little residency clinic, I had a baby that was snoring, and mom kept asking me, is that okay? I'm like, oh yeah, it's okay. And I think back to those days, I'm like, no, it's not okay. It wasn't okay at all. I feel horrendous, but this is what my teachers told me. Hey, it's not a big deal. They'll grow out of it. But I think a lot of that tonsils and adenoids is food sensitivities.
Right.
You're eating foods that are causing an allergic reaction. You're getting chronic postnasal drip. So the tonsils are huge from all that postnasal drip. So from the functional medicine side, hey, we could do something about that and resolve that with food sensitivity testing. The end result is the same because they shrink and you're breathing better versus surgery, but then you have some tonsils later. You have some glands later on too.
I know my daughter had a new procedure. They didn't remove her tonsils. They were able to just make them smaller. So she still has tonsils, which is great, which helps her, but the adenoids are long gone. But yeah, so again, going back to whether you are already diagnosed with a illness or trying to figure things out, sleep is paramount for absolutely everything. And it's something that we have to continuously monitor. I'm not saying go to bed with watches and rings on, but it can give you a lot of good data to also, I've worked with you and we could easily see with my Aura ring before supplements versus after. And now if you have any type of competitiveness in you with my cup of coffee, I want to see what my sleep score was at night. And so now my husband and I are battling who gets the better sleep scores, but my sleep score is consistently between 95 and 97 every night.
Awesome.
So I have you to thank for that. Yes. And I don't have the 2 o'clock crashes either.
And we also find that food has a big part to play in sleep too. As you said, if you eat too late, it's a problem. But also if you're not digesting very well, you're not digesting your proteins, you're not digesting fats, typically the liver wakes up and start functioning between 2 and 4 in the morning. So there's a lot of people that will wake up every morning, 2 to 4 in the morning, and not know why they're awake. Well, a lot of times it's low blood sugar. The liver's kicked in and says, oh my gosh, it's a low sugar situation. Brain is at risk. I need to make sugar. To keep the brain alive. So it makes glycogen, keeps the brain alive. And then you have a higher blood sugar in the morning than you went to bed with the night before because it always overshoots. So those people that have a high morning blood sugar, there's maybe some hypoglycemia overnight, but then you got to go back and look at blood work. Are you eating not enough before you go to bed, or are you not digesting the fats and the proteins that keep your blood sugar stable all night, so that your body literally runs out over the course of an 8-hour sleep? So that'll really interrupt sleep and cause some problems as well, and has nothing to do with sleep apnea a lot of times.
That is so interesting. So how would we know if our liver is doing that? And that would be just blood work would show us what our blood sugar is.
The liver doesn't look abnormal, but you will see low protein levels, low globulin levels, which is your immune protein. Usually, interestingly, the total protein, albumin, and then globulin are all together. They're all protein levels. but the globulin will drop your immune protein, but the albumin almost never does, because the albumin is sacred to the body, because that's what all your hormones are attached to. That's your stable storage form of all your hormones in your system, so that it can release a little bit at a time. So the body is really good at keeping albumin up. By the time albumin dropping below 4, you got big problems going on. It shouldn't be going below that, because then you're not being able to store your hormones well enough. And then you have all kinds of other issues going on along with it. But watching those two is a good clue that, hey, protein digestion's not going well. Usually along with that, fat digestion's not going all that well either. And then looking for that AM fasting blood sugar to be higher when you didn't have sugar the night before, you will see that. And you can make it even worse if you eat sugar at night. Like, how many people they're sitting down, they're staying up too late, or they're watching TV and they're snacking on sugar. Right. That is going to crash that blood sugar in the middle of the night like no tomorrow.
Right. That seems to be a common occurrence, like the sugary cereals before bed or ice cream before bed. I hear that in so many athletic and first responder demographics. My police officers, my firefighters, they're always craving the sugary cereal or ice cream before bed. That's so interesting.
It's interesting working with the Kansas City Royals when we do their physicals every year. It is uncanny. Probably about 90% of them have a high fasting blood sugar in the morning. I'm like, why would that be? They would be the ones I'd least expected. But I think there's probably a couple fold. They're either not eating enough, and so they're crashing in the middle of the night just because they've worked out so hard, or they're snacking on sugars before they go to bed and they crash, and then the morning blood sugar is sky high because the liver kicked in and did its job and made too much, because they don't have diabetes. There's no way they have diabetes. But just looking at when we're in regular practice, we see people here and there, we see a whole range, but then when you see a team all at once and you're looking at 30 blood sugars, is wow, like there's really something here, and it becomes very obvious that, hey, there's something different here going on.
Right. Yeah, it's so interesting. There's a couple quick questions that popped up already I want to get to. Somebody asked, what is the name of the California company who helps you with the sleep optimization?
It's called Empower Sleep.
Empower Sleep.
They're online and they're awesome. I've been really appreciative of how good they help with. So whether you have a mouth guard, whether you have a CPAP, whether you're just trying positional stuff because nothing else has worked, they can really work with you and try to figure out how to make it best. And that's ideal because we know that most sleep apnea stuff isn't working very well. There's also a new sleep apnea doc I started working with that actually has just a mouth guard that goes on one side that tries to balance the jaw, whichever side is not aligned quite properly. And he finds that works even better than the mandibular device to stop all the teeth grinding, the dental recession, the recession of the gums, and the loss of the
enamel.
Yes. So that starts losing. And he said you don't necessarily lose that just because you're brushing hard. It actually chips off when you're chronically grinding your teeth all night. So I think back to all these years that I was going to a dentist and they kept saying, you're brushing too hard and your gums are receding. And I'm like, I'm not brushing hard. What are you talking about? And then somebody convinced me to go do gum transplant surgery because my gums were too receded. And so I did, I think, 4 gum transplants, the front at the top, the front at the bottom. It was during my migraines. I literally had a 3-day migraine with each one because they're hitting the trigeminal nerve where they're doing the surgery. So I had to be prepared to be in bed for 3 days to do this. And I don't even remember how much it cost. But within 2 years, that tissue just completely disappeared because it wasn't me brushing. It was the fact that I was grinding my teeth so much to try to find an airway that it wasn't gonna stay because I'm moving my teeth too much.
Wow.
And dentists tell people that all the time, you're brushing too hard. No, if you're grinding, if you're receding, you've got a problem with sleep apnea until proven otherwise.
I had an appliance called a NTI, which is a nociceptive trigeminal nerve inhibitor. I talked to Dr. Mary Ellen Chalmers about it. She didn't love these only because she saw people's bite changing because what it is, it's a small appliance that goes on your top front teeth. And there's a reflex that your brain will never allow pressure to go on your 2 top teeth. So if you are not necessarily a grinder, but even a clencher, and you're starting to put pressure down, this little appliance has a shelf in the back. So when you start to put pressure down on your jaw, the appliance goes off and then you relax your jaw muscles. So it keeps your mouth open. It helps prevent the clenching, which was great because my migraines were from pterygoid and masseter muscles. However, if you're using it for a long period of time, it can definitely change your bite because you don't have pressure. So she doesn't like those appliances for that reason. However, I lost mine. I left it at a hotel room. But after 6 months, I had trained myself to not clench anymore. Talk to me about, before we answer a couple more questions here, let's just say you're not or the people who can tape their mouths shut.
Yes.
Anything, and then they put the breathe nasal strips on their nose and then are taping their mouth shut at night. What benefit can that give us?
If you wake up every morning with a dry mouth, you've got some sleep apnea because you're breathing through your mouth. So taping your mouth, definitely, we're meant to breathe through our mouth. So one of the problems with CPAP machines is that most people, when they get a CPAP machine, they have a face mask. So they're putting it over their mouth and nose both. The first thing that happens is they open up their mouth. Some of that air comes out their nose, but they're breathing through their mouth. So you're actually making sleep apnea worse. There's this amazing book called Breathe.
Yes.
I can't tell you the name of the author anymore, but I was laughing because they had it on the bookshelf at the dentist's office that I was just talking about. And it just changed my view of so much, because breathing is something that we need to be taught to do. We're not taught to breathe right anymore. And so if you tape your mouth shut, you're definitely going to be breathing better. Is it going to fix everything if your nose is congested? Probably not, but maybe there's some allergies you should look at first before you worry about everything else in there. But then practicing when you're running, going out for a walk or going out for a run, and then practicing not opening your mouth at all and just using your nose, you will feel like you're choking to death.
Yes, you're drowning. As a distance runner, I have tried this. The book is called Breath, and James Nestor. It's yellow.
Thank you.
And the audiobook is great too. So if you can't sit down and listen to it, you can just listen to it while you drive. But you will feel like you're drowning but it's amazing. You can talk to yourself. Like, you don't need that much air. You actually need to breathe out more. It's the CO2 that we need to get rid of as our exercise goes up. We actually don't need that much oxygen. It's telling yourself the right story in your head. Somebody else that asked a quick question here, Dana asked, could residential EMFs be causing poor sleep quality? What would be the best way to detect if this is the case?
They actually have EMF readers, and I'm going to blank right now on the name. I actually have one at home where you can judge the EMF put out by an outlet. All the outlets put out EMF about 5 feet. Certainly your microwave in the kitchen is probably a little bit longer than 5 feet. So if your bed is near one, but there is equipment to test for EMF locally around you. And some of it's really sensitive. I actually got in contact with a company at one point in time and have one that's sitting at my house instead of at my office where I could rent it out to people. It would be the nicer thing to do. But it got stuck at the home and never made it in, as not unusual. But there's definitely ways to test for that. Unfortunately, if you're testing for EMF from an outside antenna, you could see the antenna and know if it's close by your house, you're probably not in a very good place. The problem with testing all of that is there's not much you can do with it per se if it's from something like that. Certainly, we know we don't want to sleep next to our phones at all. The phone should be in another room. It should be off at nighttime. Or if you need to leave it on, it should certainly be in another room. And then there's different things you can do to block some of that EMF as well. The salt lamps are good for blocking some EMF, not that you really want them on in your bedroom, but they definitely help with blocking EMF. And there's a company called Therasage that actually sells some EMF blockers for your home. They're little devices that you put in different spots of your home. Every week, you put them outside for 5 minutes on the ground to recharge them and then put them back in your house. And they do a good job as well. And then there's grounding mats and all the other stuff that is out there as well. I think probably the grounding mats are the best thing you can do. They make some kind of tent that you can put over your bed too. That seems to be going way far beyond, unless you're so EMF sensitive. But the basic best thing for all of us is to turn our EMF off in our house at night, turn our Wi-Fi off when we go to bed.
Yeah,
that makes a huge difference.
Cynthia just wrote Trifold or Trifled meters. I'm not sure if that's a company that you use or she's familiar with, but I remember a story that Roger Billica talked about. Teenage boy he was working with a couple years ago.
Yep.
He was having almost like psychotic episodes, and they couldn't figure out what happened until he went back, and the parents were like, oh, it all started when he rearranged his room. And then they looked in his room, if I'm remembering it right, had this alcove, and it was like outlet after outlet, and he was basically just sleeping. They were all around his head, and he said, just move his bed next week and see what happens. And it was like night and day. So never forgot about that.
That one still sticks in my brain too. I was like, whoa, it can be that bad. And we see that a lot today in people who are sleeping next to their outlet box, the box that has all the switches in it to see whether everything's on. If that's behind the wall where your bed is, that's a huge deal. Absolutely huge deal. You could be having some of those same issues.
Panel like that. Yeah.
The breaker panel.
Yeah. Interesting. Mine's in my kitchen. It's far away. Another question that came up, Carol always mentions using concussion and concussion vagus at night before bed. Is this because it improves sleep? I'm not sure if it improves sleep, but it definitely will relax you to the point where you can go to sleep more quickly, as far as I know. It'd be interesting to do some, and that would be easy, especially with all of us with our devices, how much better our sleep quality gets if we use concussion and vagus at night.
And being somebody that's going through a divorce right now, which hasn't been a lot of fun, I finally bought actually about 2 months before my husband walked away, I had bought an EMF converter. I was like, I'm not using these damn sticky pads at night. I'm getting all wrapped up. And so I'm not using my microcurrent. So I finally gave up and said, you know what? I'm buying a PMF converter. That thing has been a godsend. I'm running all the emotional codes, anger, irritability, return joy, miracles and joy. I would not be making it through this divorce without that machine. And I use it every night, or I will give it to my son. An interesting story. I have about 8 things programmed on it. First is concussion relax. And then I have brain fog. And then I have leaky gut, leaky blood-brain barrier, and then miracles and joy and anger. And it probably lasts about 10 hours, and I never sleep that many, but so I never get to the end of them, but whatever, it's all in there. So one time I was getting really tired of my son getting and I was like, you know what, I'm just going to put you on the microcurrent. It's been working miracles for me. I'm just going to put you on it. So I put him on one night, this 8 program span. Now he's used microcurrent a ton over time because he knows to ask for it when things are bad. And so I ran it on him. And the next morning he got up doing pretty good. And then he totally crashed his adrenals that day. He needed to take a bunch of supplements. And during the day he had a migraine. I had to stop and go to the nurse for a while. He took his other supplements. And then he comes home, Mom, I just had such a bad day. I just had this migraine. I'm like, what did you have it for? What was going on? Couldn't figure it out until I went to put him to bed at night. And there's the microcurrent machine. I'm looking at him. I'm like, oh my God. I just ran 4 or 5 new programs on you that you have never seen before. Now I knew exactly what I did. So I started picking it up to take it away because I wasn't going to run it that night. I was going to put it on myself instead. And he looks at me, you're not taking that. I'm like, what do you mean? He's like, no, you're not taking it. I'm like, why? I felt the best today that I have felt in months.
Wow.
From the mouth of babes, man. And he was 11 at that point in time, so he wasn't that much of a babe. But literally, he was like, no, Mom, that made a world of difference. I don't care that I had a migraine. Now that I knew what the migraine was from, I didn't care either. But I'm like, maybe we do a little bit less tonight so you don't end up with another migraine tomorrow, because it was just too much detox for him.
Yeah.
But how powerful, number one, that it sent him into that amount of detox, because hey, obviously we needed to run those programs if it gave that much of a reaction, but that he felt so much better after one night of using it. I swear by that thing from now on, because you can move it from one kid to the other kid to myself to all of this.
Yeah, it's amazing because you just think about how many hours, and that's the biggest sticking point is people, I don't have time to sit with this machine on. I have to do this. I have to do that when you're sleeping. And if you can just stick those 2 little magic pucks near your body when you're sleeping and just get everything that way. And how great for your son, even though he had a migraine, he wasn't attached to the negative part. He still could see the bigger picture. Yeah, I had this migraine, but I felt amazing. And so I think that's a really important thing to talk about when we're talking with any patients that are listening too. Sometimes we go for a new treatment or I see a different practitioner and we get caught up in, oh, it didn't work. Why didn't it work? This hurt more. when things change, when pain increases, there's usually a really good reason why it's happening. And your practitioner can really use that information and change the treatment or support you and say, I know this happened today, but I bet you in 2 days it's going to feel so much better, or adjust it. So don't give up on things because a migraine happens or some sort of other detox reaction can happen. Even nausea. Way back in manual therapy college, some people would feel like they were getting the flu after a deep tissue massage, and it's a massage, but you just think you're just pushing through everything that's been stagnant, and that detoxification can make you feel yucky, but then you feel fantastic.
Right. And it's an important sign that something happened. Even the negatives are a sign that something is changing.
Yes.
And usually in a good way. And so I'm going to jump back to sleep apnea for a minute because it concerns my kids. My husband has more of a type 1 sleep apnea where he snores the house down. So he's been using a mandibular device for a while. I've got the more silent type. The people that have the small airways don't snore. They don't breathe deep is the biggest problem, and that interrupts. So they don't make any noise. They think they're sleeping fine. Everybody else thinks they're sleeping fine, but they're not feeling good. So it's totally different presentation of the two types.
Right.
But I came in, I realized that I had been tongue-tied. I was a twin. My mom never breastfed because she had twins. But in retrospect, she's telling me how much my twin brother would finish his milk immediately, and I would sit there and take 30 minutes yabbering in the middle and warbling and talking, and my brother would be done and finished. So I'm like, I think that was tongue-tied. And then my husband apparently had some lip tie because he's got a very tight upper lip that's pretty tight. My first kid was born, took me an hour to feed him. So this is really important for the nursing people or the parents that have kids that are getting into, if both your parents have sleep apnea, you're going to have some sleep apnea. I'm sorry, it happens. So I was really alert, but my first kid never could breastfeed properly. And so at 9 months, I finally went back to the pediatrician. I said, there's something wrong here. I know he looks normal, but it shouldn't take an hour on the sofa to get him to eat. And he's still hungry afterwards. I know I'm small boobed, but come on. And we all get into it's all about us, right? And come to find out, he had tongue tie. So he did a tongue tie surgery, didn't really change anything. Second kid comes along, and then he spit me out at 5 months. He said, I'm not doing this breastfeeding thing anymore. And he just said, I'm done. My second kid comes along. He had a noticeable divot in his tongue when he stick his tongue out. So he obviously has a tongue tie, but the pediatrician looks at, oh, he's eating fine. Okay. Noticeable tongue tie, but a divot. So about 6 weeks in, I'm like, okay, he's really not eating. It's still taking 30 minutes, 45 minutes. There's still something, it shouldn't be this long. So I bring him in, he gets tongue tie and lip tie surgery. And I'm like, So the older one at 2.5 years old now, still can't even drink out of a straw. You got to see the older one that's in the other room right now. I bet he has lip tie too. Sure enough, he had lip tie, so he got lip tie surgery at 2.5 years of age. The younger one that got both at the same time, he was sucking like a fiend like the next morning, like totally different child. But nowadays, knowing both of those, I'm like, okay, where's their sleep apnea? The little one used to fall asleep the minute his head hit the puddle. He was asleep before he walked out of the room.
Right.
That's a warning sign. There's something going on. The older one never slept. He's up 4 times a night. The covers are all over the floor. He'll fall off on the bed. He's so restless. You can't even sleep in a bed with him because he's all over the place all night long.
That's a problem.
Huge risk factor. So realizing this is a kid thing too, like you found in your daughter, the earlier we start getting them in with a dentist, they can start fixing some of those things. It's got to be a good one. Otherwise, they mess them up worse. But if you have a good dentist, the earlier we can get these kids looked at, you can fix a lot of these things while they're still growing. So we never have these kids beings as adult. When I watched all the tongue tie videos before I had tongue tie surgery for my child, he made me watch all these videos. All the side effects of unaddressed tongue tie were everything I have. Migraine headaches, neck tension, receding gums, the loss of proper chewing, grinding teeth at night. All of those were things that I had, and I'm watching this going, oh, and you're going to tell me that my kid doesn't need tongue tie surgery when you're showing me all these things that people have, and I have all of those as an adult, and you're not going to do tongue tie surgery on my kid because you said he's fine? Like, why would you ever let a parent do that? You
Right.
need to get this done. It's going to affect the rest of their life.
Right. And that's how you have to listen to your inner, all the parents out there. You have this little voice that you keep telling to shut up, and especially when a doctor tells you, oh, it's fine. And I didn't need to be an ENT to know that it wasn't fine.
And she had a lot of symptoms to teach you about that too.
Absolutely. Yes. A couple more little questions here. Dana wrote, autism is in our family and the kids subconsciously hold their breath, saying they're trying to listen better. I don't know if you have anything. We can go back to that. Trifield is a generic name for some of the meters that we're talking about. Trifield meters to measure biogeometry can correct the waveforms to eliminate EMF stress. Apparently they did it for an entire town in Denmark with neat studies. So that sounds awesome. Leaf wrote, more likely to have EMF issues with smart meter and Wi-Fi routers. Yes. So we don't need our Wi-Fi on at night. We like to turn it off so that the teenagers go to bed. They can't do anything without it other than read a book and go to sleep. So there's added benefits for just shutting that stuff down at night.
Yeah.
And then Dana also wrote, her 5-year-old asks for the juice box, which is probably not juice, but microcurrent juice box over sweet syrups when he has pain. Mouth of Babes is right. When my daughter was in kindergarten, when kids used to fall off the monkey bars, she would say, you need to come to my house and my mom will put you in the microwave. And I said, microcurrent and CPS is going to come if you don't stop saying these things. So as I just dropped my oldest off at college, one of the first things she says is, you're going to give me a custom care, right? To take with me? I'm like, yes, you'll take the old one, but you will take one to college with you. I need you to take one to college and programming cables because things are going to happen. So since we're probably just going to stick with sleep and sleep apnea on this one, getting people to sleep using microcurrent. So we talked about concussion in Vegas. If these patients are having problems falling asleep, having a device like a custom care at night can actually get them really mentally ready for sleep. They have this tool that's with them that's going to help them sleep. So that can be a very empowering thing to go to sleep with, because people who can't fall asleep at night don't love the fact that they can't fall asleep at night. They get anxious because they can't fall asleep at night. So
I can't tell you the number of athletes that I've given microcurrent to fix whatever injury they have, and they refuse to give it back to me, not because they still need it for their injury, but they're finally falling asleep like they need to, and they're like, oh my gosh, this is amazing. And I think that concussion relax is really setting people on the right path for a lot of that. Vegas too, for sure, but that concussion relax, I think, is a miracle.
Yes, yeah. So we have concussion in Vegas, relax and balance. I've made an anxiety one. There is the PTSD protocol, which is 3 hours long. So you have a lot of options on that mode bank for what you want to set somebody up with. We can do box breathing with the concussion and Vegas protocol, which is really nice. Just doing some nice deep breathing while you have it on. I will tell people, and now the cat's out of the bag because this is a podcast. When it's, can I go on my phone with it? I'll say, no, the machines scramble your iPhone. So you better just another room. Oh, okay. Because no one wants their precious phones destroyed. And then I have them hook themselves up, whether it's with cables, wet towels, magnetic converters. It doesn't matter how you're applying it, but you really just want to have them have this tool that's going to help them fall asleep. Another couple of things we talk about is, for my athletes who don't want to have a diary or a journal, we talk about a purge pad. Just write down a few things that is on your mind before you go to bed. I'm worried about my test tomorrow. I'm worried about the game tomorrow. I'm worried that I'm not going to sleep tonight. It's amazing putting pen to paper about what's on your mind. It enables that part of your to-do list to just check those boxes. So your brain is, you know what? I've done that, or I'm going to deal with it tomorrow. So right now I can prepare for sleep.
The other thing that I love a ton for going to sleep is the Heart Math app, the Inner Balance app. I got into that because everybody's, do your meditation before bed. Meditation is like 20 minutes, a half an hour. Like, I don't have that kind of time in my life a lot of time. And so I had gotten the Heart Math app. It's called Inner Balance for your phone. And then you have a little connector that you hook up to your ear that's actually reading what your oxygen is and your heart rate variability from measuring your ear. But there's a little circle that goes around. It probably takes about a minute and a half to go around that circle as you're regulating regulating your breathing and your heart rate together. And I can't get through one circle without my eyes closing. I literally cannot stay awake if I'm doing that thing. And it's easy. It's a little tiny thing you can throw in your pocketbook. You can do it anywhere, anytime.
Yeah.
And it takes a minute and a half. And you put that together with some concussion or some relax and balance, you're in, you're out.
Yes. Yeah. So there are so many things that are out there, and everybody needs to figure out what works for them. But I think it is worth for the patients that are listening. Hopefully this helps not scare you into thinking you're not sleeping as well as you can be, but for the people that are chasing their tail with chronic pain or chronic illness, addressing your sleep is going to be the one thing that is so modifiable and is, I think, so easy. You'll start to see the changes almost instantaneously, right? Just think about how good you feel after a good night's sleep, and then 2 good nights sleep, and then a whole week of sleeping well. And it's important for the patients that are listening to be honest about not just, yeah, I sleep pretty good. It's, do you drink water? Yeah, I'm hydrated. I drink Coke or I drink coffee all morning, and then I drink Coke in the afternoon, and then I have an iced tea at dinner, and you didn't even drink water. You were just consuming diuretics all day long.
And you're not going to sleep really well when you're taking all that caffeine.
Exactly.
Well, one last thing before I let you do your final closing here, because I want to get it in. I just ran into a new company that I wanted to share because I was so excited about it. It is not on the market yet. But what they're doing is they give you a sleep machine, like a little thing to wear on your finger, like this Empower Sleep does. And they measure your sleep for 3 nights. And then they're using certain sound frequencies that they put in earphones or in earplugs that they give for 4 nights while they're doing a sleep study. And it increases deep sleep by 36%, increases REM sleep by something like 35%. And it's permanent after they do it for 4 nights.
Wow.
So we're talking about the biggest problem of sleep apnea, that we still can't get our deep sleep, REM sleep, where it needs to be. And they figured out how to do it with sound. So it's not on the market yet because they're still trying to find the best frequencies that are going to have the best effect.
Wow.
But to get that deep and REM sleep in would be a game changer for people, even with some sleep apnea, if you could get that much in spite of some sleep apnea in there.
Wow. Very exciting. You're going to have to keep us posted with this.
Yeah. They asked me to be a board member because they were calling a bunch of functional medicine docs, and they were trying to put their whole company together. And they called me and started asking. I'm like, oh, you want to ask about sleep apnea? Now you're getting me going. But we talked for an hour, and they're like, would you like to be part of our board? I'm like, damn straight. I want to know exactly what you're doing all the time, because I'm in whenever you figure it out. Because this is the stuff that'll really change our lives and prevent us from getting sick. I firmly believe that this is a huge underlying cause of so many people being ill. And if you never address the sleep apnea, we're always going to be chasing our tail energetically.
Yeah. One final question. The question was wondering if FSM can be used as a diagnostic for plantar fasciitis. The condition seems elusive to my mainstream docs. They're seeing an FSM practitioner tomorrow and wanted to try to sleuth out if this could be a stress fracture due to pronation, but have to wait several weeks for x-ray with the podiatrist. Thinking about Jen's points about detoxing seems to persist more if sleep is interrupted on a regular basis. So also wondering if the persistence of this could also be a toxicity issue. I have a couple things to say about plantar fasciitis. So I have so many great results with plantar fasciitis. I did a case study on this many years ago. It took about 7 or 8 treatments for it to be effective. Feet are gnarly, no pun intended. Avascular, tons of adipose. Plantar fasciitis doesn't come from outer space. So those little intrinsic muscles of the feet don't just decide to have a temper tantrum and tighten up, causing the arch and the ligature to throw a fit right after. So we want to see for sure ankle mechanics. We want to see if a bone spur is present. So there's a lot of factors, but like anything else, if you're not sleeping and you're not able to restore and recover at night, pain is always going to be worse, whether it's in the feet or it's in your neck or anywhere in between. So
that's a classic diagnosis of fibromyalgia, is like underlying poor sleep. The worse sleep you get, the worse your pain is the next day.
Exactly. Yeah. And it's not a surprise, right? Like we all know how great we feel when we sleep great and how crappy everything hurts, whether it's, like you said, your plantar fasciitis or your low back that comes and goes. Does it come when you have a bad sleep? And does it go when you're fully rested and had a good meal that day? FSM can be great. I would say we need to know what we're looking at though. So scarring, so the 13s are really good for that. Scars 397, sclerosis in the adipose. The fat pad is always like untreated in the foot for some reason. You want to make sure ankle mechanics are good. We want to strengthen. So I have a whole bunch of stuff to talk to when I'm by myself on the last Wednesday of this month. I will put my plantar fasciitis slides in there for the anonymous attendee who just asked that question because I love plantar fasciitis. As a runner, again, my feet are very important to me. So whether it's pronation or detoxifying, I want to make sure I'm covering my bases. So we didn't really talk about autoimmune, but next time you're on, we will.
All right, sounds good.
If our sleep is taken care of, everything else is going to fall into place a little bit easier anyways.
Yeah.
Awesome.
I believe that.
Yes. Thank you again so much. I know how busy you are. Thanks everybody for coming. Next week, we're going to have Dr. Musnick on live, and he's going to talk about a whole bunch of stuff. So you're just going to have to come back and watch. Thanks everybody. Keep the questions coming, and we will see you next week. Bye.
Thanks, guys.
The Frequency-Specific Microcurrent podcast has been produced by Frequency-Specific Seminars for entertainment, educational, and information purposes only. The information and opinion provided in the podcast are not medical advice, do not create any type of doctor-patient relationship, and unless expressly stated, do not reflect the opinions of its affiliates, subsidiaries, or sponsors, or the hosts, or any of the podcast guests or affiliated professional organizations. No person should act or refrain from acting on the basis of the content provided in any podcast without first seeking appropriate medical advice and counseling. No information provided in any podcast should be used as a substitute for personalized medical advice and counseling. FSS expressly disclaims any and all liability relating to any actions taken or not taken based on or any contents of this podcast.